Hey y'all, welcome back to MedTalk by Galloway-Sands Pharmacy. I'm Kassidy, pharmacy tech here in Southport.
And I'm Brad, pharmacist at Galloway-Sands. Thanks for spending a little time with us today.
So we're going to jump straight into one we hear every single week at the counter. I feel terrible. Can you call my doctor and get me an antibiotic?
Yep. Or, I've got this awful sore throat and runny nose. I just need a Z-Pack and I'll be fine.
And a lot of times it's folks who are truly miserable. Coughing, stuffy, maybe a low fever. They're like, I can't miss work again. I need the strong stuff.
For sure, and we really feel for them. But here's the key thing. Most of those just a cold type illnesses are caused by viruses, not bacteria. And antibiotics only work on bacteria.
So what kinds of stuff are usually viral, like the basics?
Most common colds, most sore throats, most chest colds or bronchitis, and the flu, those are usually viral. That means your immune system has to do the heavy lifting, not an antibiotic.
And the flip side, when are we looking at bacteria?
Things like strep throat, some ear infections, some sinus infections, urinary tract infections, and pneumonia can be caused by bacteria. That's when an antibiotic can really make a difference.
I hear people say, but my mucus is dark green. That means I need an antibiotic. I feel like we hear that every cold season.
Oh yeah, thick yellow or green mucus can definitely look scary, but by itself it does not prove you have a bacterial infection. Your body can make colored mucus even with a regular viral cold as it's fighting things off.
So green doesn't automatically equal go get antibiotics.
Exactly. Doctors look at the whole picture. How many days you've been sick, how high the fever is, how you're breathing, how you sound when they listen to your chest, stuff like that.
Okay, so here's the pushback I get a lot. Well, last time I had this same thing, my doctor gave me an antibiotic and I got better in a couple days.
Yep, that's the big one. And I get why that's confusing. But a lot of viruses, regular colds, even some sinus and chest colds, naturally start to improve after about a week, sometimes a little more.
So if you go to the doctor on, say, day 6 or 7, and you start an antibiotic that night, it might look like the antibiotic was the magic cure.
When in reality, your body was about to turn the corner anyway. The timing overlaps. We remember, I started the pill and 2 days later I felt better, not, I was already a week into this thing.
That's kind of like when you take cold medicine and you're like, this works great, but maybe you were about due to feel a little better anyway.
Right. There's also what we call the placebo effect. Just doing something you believe will help can make you feel a little better, sleep better, notice your symptoms less. It's not fake. Our brains are powerful.
And sometimes, too, people forget they were doing all the other good stuff. Rest, fluids, maybe a nasal spray, cough medicine, hot tea. It all kind of gets credited to the antibiotic.
Exactly. None of this means folks are imagining their illness. You really are sick. We're just saying in a lot of just a cold situations, your body, plus good home care, is what actually did the work, not the antibiotic.
So, bottom line for this first part. Most colds, most sore throats, most chest colds are viral, and antibiotics don't touch viruses, even if you feel awful and even if your mucus is gross.
That's it. And using antibiotics when they're not needed doesn't make them extra strong. It can actually cause problems, which is what we'll get into next.
All right, Brad, let's talk about the part people don't always see. The risks of taking an antibiotic you don't really need.
Yeah, and I want to say this gently. Antibiotics are life-saving when we use them for the right things. But every medicine has downsides, and antibiotics are no exception.
So what kind of side effects are we talking about?
Common ones are rash, nausea, diarrhea, and yeast infections, especially in women. Some people get real stomach upset, cramping, loose stools. Certain antibiotics can trigger a more serious gut infection called C. diff, where you get bad, sometimes dangerous diarrhea.
We filled prescriptions for folks trying to fix problems that started from the first antibiotic. Like, I took this and now I've got this rash, or now I've got a yeast infection.
Exactly. And some people have true allergic reactions, hives, swelling, trouble breathing, that can land them in the emergency room. The CDC has pointed out that antibiotic reactions are a big reason kids end up in the ER.
So taking an antibiotic just in case for a cold isn't harmless. You're trading a viral illness your body would probably be on its own for a chance at new problems.
Right. And there's another big piece, antibiotic resistance. That's when bacteria learn to outsmart the drug. The antibiotic kills off the easy-to-kill bugs, and the tougher ones survive and multiply.
So it's like we're training the bacteria to be stronger?
Pretty much.
Over time, those stronger bacteria don't respond to the usual antibiotics. The CDC calls antibiotic resistance a major public health threat because it makes infections harder, sometimes much harder, to treat.
And that's not just some far-off hospital problem. That can be here in our own community, right?
Absolutely. Every time antibiotics are used when they're not needed, like for most colds, we're adding a little extra pressure that pushes bacteria to adapt. It adds up across towns, states, the whole country.
So when you tell someone, hey, you probably don't need an antibiotic for this cold, you're not just being picky. You're trying to protect them now and also protect future patients.
That's right. That idea has a name: antibiotic stewardship. It just means using antibiotics wisely, the right drug for the right infection at the right dose for the right amount of time.
How do we do that here at Galloway-Sands? Like on a normal Tuesday in cold and flu season.
Well, first we talk with people. If someone asks for an antibiotic for a clear-cut cold, we'll explain why it might not help and go over other ways to feel better. If they already have a prescription, we'll double-check dosing, allergies, and any interactions.
We spend a lot of time on the phone with doctors' offices too. If something doesn't look quite right, we'll call and say, hey, can we clarify this?
Exactly. And when an antibiotic truly is appropriate, we want people to finish it as directed, not stop early when they feel better, and not save leftovers for next time. No sharing with family either.
So stewardship isn't about saying no to antibiotics. It's about saying yes when they're really needed, and let's try safer options when they're not.
Well said, and we're always happy to have that conversation. If you're ever unsure, call us, stop by. We can't diagnose, but we can help you sort out good questions for your provider.
All right, let's get practical. Folks listening are probably thinking, so when do I actually need an antibiotic, and when do I just ride it out?
Good question. We'll keep it simple, but remember, your own doctor or provider makes the final call for your situation.
Let's start with sore throats.
Most sore throats come from viruses, especially when you've also got a runny nose or cough. Strep throat, which is bacterial, usually needs an antibiotic. Providers often do a quick strep test to tell the difference.
What about sinus infections? People get really frustrated with those.
The first week or so of sinus pressure, congestion, and thick mucus is usually still viral. If it drags on for many days without improving, or gets better then suddenly much worse with high fever and facial pain, that's when a provider might think bacterial and consider an antibiotic.
Ear infections?
Some ear infections, especially in younger kids with a true middle ear infection, may need antibiotics. But not every earache does. That's where an exam is really important.
And those chest colds, bronchitis, that make you cough your head off?
Most of those are viral and don't need antibiotics, even if the mucus is colored. Pneumonia, on the other hand, is more serious. Fever, shortness of breath, you feel really sick, and that often does need antibiotics.
And the flu is viral, so antibiotics don't treat that either. There are flu antivirals sometimes, but that's a whole separate thing.
Right. So here are some good questions you can ask your provider. Do you think this is more likely viral or bacterial? If it's viral, what can I do to feel better while it runs its course?
I like, if we don't use an antibiotic today, what should I watch for that means I need to call back? That way you know the red flag symptoms.
Exactly. Things like trouble breathing, chest pain, confusion, not keeping fluids down, or a fever that's very high or not improving, those are reasons to seek urgent care or emergency help. For kids, not waking up, not making wet diapers, or working hard to breathe are also big red flags.
Okay, say the provider says, no antibiotic, it's just a viral cold. What can you actually do at home so you're not miserable?
Number 1, rest. Your body heals when you give it time. Number 2, fluids, water, broth, electrolyte drinks, to thin mucus and prevent dehydration. A humidifier or steamy shower can help loosen congestion.
I'm a big fan of saline nasal spray or a rinse. It's not fancy, but it really helps clear things out without adding more medicine.
Great option. For adults, we can talk through over-the-counter pain relievers for fever and aches, decongestants for stuffiness, and certain cough medicines. For kids, it's different. We're very careful with age limits, especially under 6. Always ask before giving a child anything.
And honey. For kids over 1 year old, not babies, a spoonful of honey or warm honey in tea can really calm a cough.
That's a good old-fashioned remedy that actually has some support behind it. And simple things like propping your head up when you sleep, avoiding smoke, and using lozenges for sore throat can make a big difference.
So we're not saying do nothing. We're saying do the things that actually help instead of jumping straight to an antibiotic that doesn't touch viruses.
Exactly. To wrap this up, antibiotics are wonderful tools for bacterial infections like strep throat, some sinus and ear infections, UTIs, and pneumonia. They don't treat colds, most sore throats, flu, or most chest colds. Those are usually viral.
Using antibiotics only when we really need them protects you from side effects now and helps keep them working for all of us in the future.
And remember, this is general information, not personal medical advice. Always talk with your own provider or with us at the pharmacy about your specific situation.
If you're not sure what to ask, come see us. We'll help you sort out questions for your doctor and go over safe options for your symptoms.
Thanks for listening today. Kassidy, always good chatting with you.
You too, Brad. And thanks to all of you for trusting the Galloway-Sands family with your care.
Take care of yourselves, use those antibiotics wisely, and we'll talk with you next time.
Feel free to contact us with any questions you might have. We are here to support every one of your health needs. Supply location: 58 Physicians Drive, Northwest, number 5, Supply, North Carolina. Open 9 a.m. to 6 p.m. You can call us at 910-754-7200. And Southport location: 1513 North House Street, number 8, Southport, North Carolina. Open 9 a.m. to 6 p.m. And you can call at 910-454-9090. Have a nice day, everyone.